Hello again. Today we're going to be going over the immunology and serology homework. And this is my living room. Got my nice soft blankie and a napping puppy. Anyways, so let's get started. Number 1, what are some examples of a malfunction in the immune system? So that would be an immunodeficiency, allergies, neoplasia, or autoimmune disease. So to be a little more detailed, like being allergic to something such as like anaphylaxis, or the body's immune system is freaking out over a peanut, like no big deal. Or like an autoimmune disease, like the immune system is actually attacking itself. So those would be some examples of a malfunction. What are the two major types of defense systems in the body, and what's the difference? Sorry about that. It's my healer. He is a little defensive over his territory. So the two major types of defense systems in the body, and what's the difference? So our innate immune system is what our body naturally has occurring. So that's something that we already have. Those are like our little soldiers that are going around just doing their job. And then our other one is adaptive. So the difference there is that that's something that like our memory cells, like say we've been exposed to something and we've developed an immunity to it. So that would be your adaptive. So you have the natural is what you usually have, and then your adaptive, which is what your body has created. And I'll go over a little more detail on that once we look at our, I'll go over the chart that I made for you guys. What is the first line of defense in innate immunity, and give examples? So our external barriers will be our first line of defense. So your skin or your mucous membranes, thinking that this is helping to prevent organisms from actually getting into your body right off the bat. Another example is your GI tract. So thinking that your inside of your GI tract acts more as like an outside. So you've got bile acids that can kill things, and then thinking like your mucous membranes that line the internal part of your GI tract helps prevent stuff from seeping into your bloodstream. What are signs of inflammation? So that would be pain, heat, redness, and swelling. Remember your white blood cells from hematology. Name them in order from most common to least common. So there's stuff like this, it's always going to come up, and we want to make sure that we keep thinking about different things, not like you just learn something and forget it and move on to the next subject. We're always going to be integrating these things together. So back to the answer, it's neutrophils, lymphocytes, monocytes, eosinophils, and basophils. One of these above cells migrates to tissues, phagocytizes invaders. What's it called once it enters the tissues? So going back, that's our monocyte, and then in the tissues, it's a macrophage. Another leukocyte phagocytizes cells. What one is that one called? That's our neutrophil. Which two leukocytes are involved in the inflammatory response? So we're thinking more allergies here, and that's our eosinophils and our basophils. And then lastly, which leukocyte is important for adaptive immunity? And that's our lymphocyte. And remembering, we're going to go into talk about B and T cells. Describe the difference between T cell lymphocytes and B cell lymphocytes. So our T cells are our attackers, and our B cells are our memory antibody stuff. So looking at the little chart that I made for you guys when we're talking about B cells versus T cells, our T cells originate in bone marrow as well as our B cells. But to help you remember the difference, the T cells are in the thymus, and our B cells mature in bone marrow. Our T cells live in lymphoid tissues, where our B cells are constantly circling in our bloodstream. Our T cells are cell-mediated immunity, where B cells are humoral. So thinking like a humerus or a humor is a liquid. So like you have your humor that's in your eye. Technically, your blood is a humor. So remembering humoral is they're circulating in the blood. The helper T cells activate cytotoxic cells, and they activate B cells. So your T cells help signal your B cells to activate. T cells also have cytotoxic cells, so they're just going around killing infected cells when they see them or run into them. The B cells have plasma cells, which secrete antibodies. Again, your T cells are attackers, and your B cells are more like your introverted smart cells, where they're waiting to recognize an antigen, and they can even clone themselves to have more antibodies against that antigen. T cells are non-specific, so they're just targeting cells that don't quite look right, and they're taking care of them. And our B cells have antibody memory for when that same invader comes again. So they're not super particular on what they're taking care of, whereas the B cells are. Number 11, there are 2 types of T cells involved in cell-mediated immunity. What are they called and what do they do? So we have our helper T cells. They're there to signal and activate B cells, and they're there to signal the cytotoxic cells. Our cytotoxic cells kill infected cells. So helper T cells are the talkers, and the cytotoxic cells are the doers. Name 5 immunoglobulins and what they do. Our IgM is the largest, and they're the first responders to the scene. They're also there to activate the complement system. IgG is the most abundant, and usually we're dealing with allergies. IgA prevents attachment of the pathogen to mucous membranes. IgE also has to do with allergies or parasitism, and are involved in anaphylaxis. IgD, they kind of do some complex things, so we don't need to necessarily know all the details, but they are a B lymphocyte antigen receptor. Number 13, what is an example of passive adaptive immunity? So that would be immunization. So this is going to be like, say, on our chart where we go to our adaptive or acquired immunity. Your active section of that would be, what's happening in your the T cells and the B cells. And your passive is what you're getting from the outside world. So say immunization, like we talked about, vaccinations is one, or getting immunities from the mother, like as a baby. Name different routes a vaccine can be given. So there's IM, sub-Q, which is our most common route that we do in practice, transmucosal, intranasal, or oral. What are 3 basic components of the ELISA test? So that would be our solid phase, conjugate, and chromogen. Number 16, I'm going to read out the sentence with the answers. Most ELISA tests check for antibodies. The FELV, feline test for an antigen. So that's different, whereas most of them do test for antibodies. That test goes for antigens. And our Giardia ELISA tests for cyst wall protein. Number 17, why is Coggan's test so important, and briefly describe how it works. So this test is for equine infectious anemia, and it's tested by immunodiffusion. So you'll see this test where If a horse is going to go to a competition or a show or be sold anywhere across like a state border, or I guess country could be considered too, they can carry this infectious anemia with them. And so it's important to have this test, and they actually have like a certificate where it's extremely detailed on like what the horse looks like, the horse's record. They'll take photographs of the horse, or they have a little diagram where you can draw the images of the horse. So it's really particular per patient. And this test involves like an agar plate with wells. And there's a positive control and a negative control. And then when you put the sample in, a line will form in diffusion, like agglutination, to form a line towards that positive or negative control. Number 18, what disease is the Coombs test used for? That's IMHA. And then I had a little side note. So HIV and AIDS, so we know that that's an immunodeficiency, and I just had found this along the studies when I was trying to help find resources for you guys, but that actually affects the helper T cells. So knowing that our helper T cells signal to activate our B cells and cytotoxic cells, if you have a disease in those helper T cells, this other section of your immunity cannot even be activated. So I thought that was pretty interesting to learn that that's, HIV and AIDS affects your helper T cells. And that's kind of a big deal. So moving on, number 19, describe how an antibody titer works. So a patient's serum is diluted into different concentrations, and your result will be written in the last dilution that the antibody was found in. So of course, the more dilute that you have to go, the higher your number is of that antibody. So you'll start off at they'll start like a 1 to 2, then a 1 to 4, a 1 to 8, 1 to 16, 1 to 32, 1 to 64, 1 to 28, etc. Usually 1 to 28 is about as high as it goes. It can go higher. But knowing that the higher you go, the more dilution it's going to take to get that antibody out. And then what's the difference between sensitivity and specificity? So it's the ability of the test to be positive is your sensitivity. Your specificity is the ability of the test to be negative. Number 21, what are some common causes of false results in serology? Sample quality is one, so like say hemolysis, inadequate washing, like if you have some kind of cell washing that you're doing, if that's not done appropriately. Improper incubation, so temperature-wise, we know changes in temperatures can cause false results. Sorry if you got dizzy there for a minute, I almost dropped my phone. Expired kits, improper handling, and following directions. I cannot stress enough, even if you've done a heartworm test 100 times or thousands of times, check your instructions and look over it and make sure you're doing it correctly. You'd be surprised how out of habit and over time you may have started doing something incorrectly. And that goes for like all your tests, whether it be an ELISA SNAP test or your in-house chemistry machine or your CBC machine, or if it's like a dipstick, maybe you should look and see like a urine dipstick and see what's going on there. That's something I learned at a CE one time, is they actually passed out instructions of common tests that we do in hospital to everyone and was like, read these and see if you're doing it right. And surprisingly, there's stuff you're doing wrong. And that's really important to know because you can get false results. And then number 22, what happens when a cross match is incompatible? I hope everyone got this. It was on your lab exam, and that is agglutination. And then we're going to go on to our terms. So PCR, it's one of our serum tests. It's polymerase chain reaction. Immunity is the ability to resist infection, and it's also, you can call it protection. Commensal bacteria is a normal flora. It's the frontline soldiers to compete against invaders. So maybe you have some bacteria on your skin. Actually, not maybe, you do. They can compete, and in competing, they could kill the other bacteria and prevent it from whatever kind of pathogen from getting into your body. Colostrum is the antibodies in mother's milk that you get from the initial feeding after birth. Complement system is antibodies and phagocytic cells working together to clear out invaders. Our NK cells are natural killer cells. Those guys are just like little soldiers circulating and killing invaders. Dendritic cells are similar to natural killer cells. However, once they kill an invader, they send a signal to message the T cells. A cytokine is a chemical secreted by immune cells to have an effect on other cells. So the cytokine is actually like the communication. An immunoglobulin is a protein. So that's like the IgG, the IgD. That's antibodies, helps antibodies recognize specific invaders. Humoral immune system is the immune system that is in the liquid portion of your body, so like blood. An antigen, so antigen and antibody are kind of two words that get mixed up really easily, but remember, antigen is the invader component that activates the immune system, and the antibody, like your body, a protein produced in response to a specific antigen. An adjuvant is a substance that enhances immune response to an antigen. So that's, say, vaccinations that might be a killed vaccine, like say a killed virus, might have an adjuvant because a killed virus isn't going to cause a response as much as a live one, but a live one will make you sick. So a killed virus will have the adjuvant to help boost immunity without making you sick. ELISA stands for enzyme-linked immunosorbent assay. Serology is a diagnostic examination of blood serum. Immunoassay is a diagnostic test assessing the presence of antibodies or antigens. Immunodiffusion, like in our Coggins test, is measuring antibodies and antigen via the precipitation of blood through a specific medium. So that would be like the agar. Seroconversion is the change in titer, basically from infection to detection. Failure of passive transfer is important to remember in large animal, and you see it commonly in foals, which means their failure to receive antibodies from the mother. So whether they didn't get to nurse, or if for whatever reason the colostrum didn't have the antibodies that the foal needed, they get really sick, and actually it's a high mortality to those little foals. A major crossmatch is 1 drop of donor red blood cell and 2 drops of the recipient plasma. Autoimmune is your immune system mistakenly attacks your own body. And last but not least, histamine. Histamine is released by cells for inflammation and allergies, and it helps in the dilation of capillaries. So as your capillaries are being dilated, it gives a better flow of your blood to those areas so that your immune cells can help with healing and attacking invaders. And then remembering that our mast cell tumors are part of the histamine response. And when you're thinking of those tumors, you're thinking of histamines. And then that's about it. If you guys have any questions,